have a look at this clinical question. Okay, great. I'll stop you there. Very interesting. So there's a big spread of answers. This is more challenging than the one that we've just done. So the three popular answers are B, orlistat, F, tirzepatide, and G, refer to secondary care for specialist assessment. Okay. For example, you might refer to a specific weight management service. Okay. So that's the main spread. And then a few people have picked C, prescribe liraglutide. Now, for those of you sitting MRC-GP, it's important to remember that this is a GP exam. So if the question says like this, prescribe, it means that you're prescribing it. Whereas, for example, there are some things that someone might meet the threshold for prescribing, but if it needs to be prescribed in secondary care, then the right answer wouldn't be for us to prescribe it. It would fall under G. Okay. The correct answer here, though, is B, prescribe orlistat. All right. Now, two things about this. So one is there's, the knowledge side of the guideline. So what's the threshold for prescribing orlistat? Anyone know what the default threshold is in terms of body mass index? Type into the chat. 30 plus. So how come we can prescribe it in this patient? Because in patients with additional risk factors, the threshold is 28 plus. Okay. I can see they've got hypertension. Similarly, if you had a patient with diabetes and they've got an additional risk factor, then the threshold drops. So it's 28 and above. And then the other thing is a bit about technique. Let me know in the chat, is there anyone that thought it was orlistat, but then didn't want to put B because the answer to the last one was B? And they thought, either you thought you can't use the same option more than once, which in a set of extended matching questions, you can use the same option once, more than once, or not at all. Or you thought, well, although you can use the same one more than once, they wouldn't put two in a row with the same answer. And so although this is what fit and you were drawn to it, that was your first instinct, you actively changed your mind because you thought, oh, they're trying to get me. They wouldn't put two in a row, and you changed it from B to one of the others. Yeah, so more than one person has done that in most cases, okay? That's a really important thing. So I call the EMQ trap. Treat each question in a set as a separate question. Just pick the answer that fits. But the other thing is, if you are naturally drawn to something, there's a reason you're naturally drawn to it. You either might have read it, and while you don't think you remember, subconsciously your mind remembers, or you might have actually seen a patient and thought, I had a patient like this, and I remember, oh yeah, because I had additional risk factor, we could start it even though they weren't 30, I actually prescribe them this, and you remember it, okay? Hope you found that helpful. Please do subscribe to the channel, like and share with your colleagues if you'd like more content.